Hey everyone, I'm Courtney Brantley, and I'm a former UNC School of Medicine Charlotte campus student. I was a part of the first cohort of longitudinal students here in Charlotte, affectionately known as the Click Six. After medical school, I went on to complete my pediatric residency and chief year at Levine Children's Hospital right here in Charlotte. I'm now a pediatric hospitalist at Levine Children's and have the privilege of serving as our outpatient pediatric clerkship director for our current students. I want to thank all of our preceptors for their time and dedication. As I've transitioned into an educator myself, it's become apparent to me just how much time and dedication it truly takes to teach. Your passion and commitment to so many students, including myself, is invaluable and appreciated more than you'll ever know. Your contribution is truly shaping the future of medicine and will leave a legacy that will continue well past your time with any individual student and even your own retirement, which is pretty cool to think about. Thank you for everything you've done for our students in our program. We really appreciate you.
Hello, Charlotte. My name is Kramer McCullen. I am a former UNC Chapel Hill School of Medicine grad of 2017. I currently work at the University of Pennsylvania, where I am a hospitalist and ultrasound fellow. I completed the longitudinal curriculum in one of its first years. There was a group of 7 of us at that time, and all of us still stay in touch, send each other Christmas cards. We really created a family there. But I think one of the most valuable parts of the longitudinal curriculum were the preceptors. You guys helped me to lay the groundwork in my future career. During the longitudinal curriculum, we had longitudinal ultrasound training. I'm currently the first family medicine ultrasound fellow here at Penn doing a year-long fellowship. You guys allowed me to explore my interests, especially in LGBT health and HIV care, and I'm currently completing the national curriculum in HIV training for specialization in family medicine. At what was Carolina's Medical Center, now Atrium, I was really able to explore my passions. I was able to feel supported and valued and appreciated by the faculty there. I knew from the start that I wanted to go into family medicine, and in each rotation, every preceptor allowed me to garner from the rotation what would be most valuable to me as a future family medicine provider. And that allowed me to succeed here at Penn as a family medicine specialist. Without Click, I don't know where I would have been today, but really appreciate and love you guys. Thanks for everything that you have done.
Hey everyone, I'm Eric. I was at the Charlotte campus a couple of years ago. I'm dressed up because I'm fresh off of the Zoom interview, although you are as important to me that I would dress up for you too. But we're asked to say our favorite thing about preceptors. And I think my favorite thing when I think back to my many preceptors was their good humor. You know, to take a third year medical student is maybe kind of a daunting proposition, I imagine. Having someone, interview your patients that you have a longstanding relationship with, or do, a speculum exam for the first time, or try some new procedure, and to have you coaching us through it and investing a little bit of trust is not lost on us. But I also find that many of you approach each of these situations where your med students probably aren't going to be at the top of their game ever with humor, that you kind of support us through our stumbles and our successes, always with a smile on your face. Thank you so much for all the good teaching you provide. You've been a medical student too, so you have some sense of how important it is, but really getting to be under your all's tutelage is really second to none at Atrium. I so appreciate you.
So my name is Jason Gonzalez, and I was a part of the first year of the Charlotte Longitudinal Integrated Curriculum, the original Click 6. Since graduating medical school, I have completed my residency in internal medicine and pediatrics in a combined residency, and am now practicing primary care in a community that I very much love. Joining the longitudinal program as a medical student was not just something I volunteered for. I fought for it. I saw the advantage of it early on, and I wanted to be a part of that process. I wanted to be a part of that program. I wanted that relationship with my attendings. My preceptors, while involved in the program and beyond, took a very keen interest in my medical aspirations, my goals, my life. They recognized challenges and hurdles that I sometimes didn't even see myself at the time, and certainly had a profound influence on the doctor that I eventually became. My practice style now exists as sort of a mixing pot of everything that I could take home from my preceptors. Every patient that I see now gets the same compassion, the empathy that my preceptors exemplified. Obviously, with maybe a little bit of my own twist on that, my own flair. But certainly, they are there with me for every patient visit. I now have the wonderful opportunity and privilege to be a longitudinal preceptor myself. I get to work with medical students, and while we've all kind of put ourselves on this lifelong path as the lifelong learner, it's certainly interesting to be on the other side of things, where now there is someone else that I have the ability to pass on not just knowledge and style, but wisdom and the joy of medicine. It's really been a terrific experience so far, and it's something I intend to do for the remainder of my career. So I thank you, preceptors. Special thanks to my own preceptors now, those many years and counting back. But thank you, all of you, for all that you do. I wouldn't be here without you. Thank you.
Hello, UNC Charlotte campus. My name is Luisa Paredes. I am a UNC a medical school graduate from the class of 2019. I did both my third and fourth year of medical school at the Charlotte campus, and I absolutely love my experience. I am currently a second year internal medicine resident at Brigham and Women's Hospital, and I want to take this opportunity to thank the entire UNC Charlotte campus, and especially our outpatient preceptors, for truly shaping the way that I practice medicine today as a real doctor, which I never thought the day would come. Thank you all for taking the time, the energy, and the effort to welcome all of us, myself and all of the other students that rotated through the Charlotte campus. Thank you for taking the time to have us in your clinic, teach us your ways. I don't remember completely, to be completely honest, I don't remember all the details of what you taught me, but I do remember how you treated your patients, the way you made them feel, and the fact that you made me feel important and that you made me feel like a part of the team. As a clueless medical student, I was just absorbing everything around me. So thank you for shaping the way I practice medicine and will practice medicine for the rest of my life. I want to give a special shout out to Dr. Dews in pediatrics. You were the best outpatient preceptor that I had. I absolutely loved working with you. And of course, I want to thank Dr. Cheng for being my hero, my mentor, my friend, and for being the person that guided me through so much in medical school and continues to guide me in life. In addition to that, I want to thank Dr. Lewis from the emergency medicine department for teaching me your love of ultrasound, which I continue to pursue and practice, and Dr. Wares, also from the emergency department, for teaching me your love of simulation, which I'm also continuing to explore. Celeste and Helen, for all your coordination and for making the outpatient rotations be so smooth and so fun and so well organized. And also to the leadership and Dr. Tarantino for just making sure that our rotations and our entire experience was so positive. I continue to think of UNC as the best medical school I could have possibly gone to, and going specifically to the Charlotte campus being the best decision I ever made. And even though times were hard at times, I think I still remember that experience as being one of the best of my life. I learned so much, I made so many friends, and I was lucky to have you all as preceptors and mentors throughout that time. So thank you for all you do, for all you have done, and I hope that you continue to teach because you're amazing. So thank you, preceptors. Thank you, leadership. Thank you, UNC Charlotte campus, for all you've done for me and for the rest of us. Bye-bye.
Hey, everybody. It's Judd Heidemann. I'm over here in Nashville, Tennessee in my first year of pulmonary and critical care medicine fellowship. But I really miss you all, and just wanted to say a huge thank you to my preceptors and faculty and staff at the UNC School of Medicine Charlotte campus. Really miss you all. Thank you so much for all the mentorship and all the coaching along the way and encouragement to get me to this point. I can honestly say that the experience that I had with patients, watching your professionalism and watching how you talk to patients at the bedside and through difficult situations has really helped form the way in which I interact with patients. And not only has it given me a model for my own future practice, but it's quite honestly the place that I want to end up practicing is in Charlotte. And it's been because of your encouragement and your support. I really, really am so thankful for all of the times in which y'all helped me to and sat down with me to think about my future career, what things made sense in terms of a pathway towards internal medicine, and what strengths and weaknesses I had to be able to get to this point. It's been an amazing journey so far, and I just hope to keep y'all included in my path forward. But thank you all so much for all the mentorship, and we send you so much love from Nashville. Hope to get back there soon. Take care, y'all.
Hi, I'm Katie Robinson, and I am a graduate of the UNC School of Medicine class of 2018 and a proud graduate of the Charlotte program. I'm currently a third-year pediatric resident at Lurie Children's in Chicago, but I'm excited to be returning to Charlotte next year. I can't thank the Charlotte preceptors enough for their dedication and help. After doing residency at another institution, I realized how lucky we are to get the training that we did and to work with such wonderful outpatient preceptors. All my preceptors made me feel like a valuable member of the medical team and taught me so much, and the way they interacted with their patients was incredible, especially as someone from Charlotte. To see all these doctors that I have known for so long in the community and work with them and see firsthand how wonderful they are and learn so much about medicine and their personal life and how to navigate all of that as a future physician, all of these things meant so much to me. We're so lucky to have you, and thank you all again for your help.
Hi everyone, Rebecca here. I was a med student there a few years back now. I am currently a first-year fellow here at Texas Children's Hospital in Houston in gastroenterology, and I just completed my 4-year pediatric residency here as well, including 1 year where I was abroad taking care of children with HIV in Africa. I wanted to say thank you to all the preceptors for many things, but most importantly, for the trust and confidence that you guys place in us at such an early stage in our training. I think this is second to none, and I think this is really what helped to shape me as the physician I am today. I know coming in as an intern at a huge institution, I felt much more confident than a lot of my colleagues because of the way that you guys challenged us to take care of patients and to own our patients, even when we were just third-year medical students. And I really think that that is what helped me to be so successful so early in my training. The other thing that I think is really important is the way that you guys mentored us, and not just talking about the way that you mentored us as budding physicians, but also just as people and in our career. And I feel like the way that you guys cared for us is the way that I hope to care for those that are training under me, the medical students and now the residents as well. I think that compassion for us as a whole person really just helps to foster us to take on new challenges and to grow as a physician and as a person. And I really thank you guys for that. I find myself still bragging about being a part of the Charlotte Longitudinal program. And I think, honestly, anyone who's not a part of a longitudinal program that is as great as the one in Charlotte is really missing out. And so I just thank you guys all for the time and the effort that you put in. I know it takes a lot more to train us in a longitudinal manner than it does in the traditional. And I just thank you guys for going out of your way and going above and beyond to train us. Miss you guys. Take care.
Hi, this is Angela Kai from the CLIC class of 2016 and MD-MBA class of 2017. Just wanted to take a minute to say thank you so much to the Charlotte preceptors. I'm currently in my last year and 4th year of training in emergency medicine at SUNY Downstate Kings County in Brooklyn. Having just a few years as a teacher under my belt as a resident, I've really come to appreciate how much care and attention the Charlotte preceptors went into making sure we had good education, making sure that we were incorporated to the care team, and really feeling valued as part of the care team. I really look back on those years at Charlotte really fondly, even with the small perks that included great food and the lounges, but also just the people. Really miss being there, and thank you so much for everything you do to teach our next generation of physicians.
Hello from Celeste. I just want to say I appreciate you all for all you've done in precepting medical students. Here I am in the command post of scheduling, and I want you to know that I have totally appreciated all the times that you have taken my emails and my phone calls and my schedule changes and a little bit of begging along the way. You've never failed to be of good cheer. I am so lucky to have worked with you and also with these students that over the years, I've seen them on their first day of clinical experience, and I've seen them at graduation, and I hear from them afterwards as they go out into residency and establish their careers. The things that they get from you, the role modeling, the teaching, working with your patients side by side with you is just invaluable. I get to see it every day. I think I'm the luckiest person here tonight. Thank you.